Hi, we have Traci here. She's a great Pilates instructor here. So she's been doing this for how long?
Over 10 years.
Over 10 years, you know. So, you have some issues with the hips and low back a little bit, Traci?
I do, yeah. As a former dancer, I have hypermobility, so I make up for it. So I got really tight hips and some low back stuff going on, and a little crooked twisting.
Okay.
Yeah.
Any sharpshooting pain down your legs at all?
No, nothing sharpshooting. Just some dull aching stuff when I move in a certain way.
Okay. Any particular areas that's worse, like right side, left side, that's worse on your?
Right now it's my left misfiring because of some rotation stuff. Yeah.
Okay.
Yeah.
Right. And typically, you know, what we do with our patient that has, you know, hip issues, we do a lot of stretching with our patient, a lot of myofascial release and active release, a lot of what we call PNF to mobilize the hip and pelvis for Traci. So we're going to start with that. So first thing we have her do is go face up for me, Traci. We'll start with this here. So again, a lot of the stretch that we do is trying to enhance the low back area by opening up the hips and pelvis. So typically when we stretch them out, we always tell our patients, anytime you have any pressure in the groin, let me know, Traci, and we'll back up. And Traci does have a little bit right there. So typically with that we're going to rotate the hips outward a little bit. I'm sorry, the knee and the ankle. And we're slowly going to stretch that out for you. All right. How are we feeling? Still good?
Still
in, mostly in glutes. All right. Hold it right there. Go ahead and resist that for me right there, Traci. And nice job. Good. Keep going. And relax me, Traci. Good. Push up again for me. And relax me. Perfect. All right. We're going to rotate this all the way over. And again, the hip range of motion. With this here, again, we're checking for any musculature tightness in the hip area too. So when we bring this all the way over, again, Traci's going to feel a little bit in her groin. Now, not everybody will feel this in their groin as they stretch, but again, with people that have more instability in their hips, they're going to feel a little more. So push up for me right there, Traci. Good. And again, and relax me, Traci. And again, with this one here, we want the legs to be level with the ground as we bring the knee downward. Alright, and after that, we're going to lock the knee here. I'm going to bring this all the way down, Traci. Now you should feel more in your low back right there, Traci.
Yeah.
Now again, you're going to feel some release in the low back region too, as in the joint is popping. Even though we're not really adjusting the joint right now, we're just trying to open up the QL muscles and the hip muscles and the glutes. Push up me right there, Traci. And relax them. Again, I'm doing some active release and trigger point around the hips and piriformis and the TFL muscles right there. And relax me, Traci. Bring this all the way over. Good. Alright, I'm going to lock the knee. Bring this all the way up from you right there. Again, Traci, anything in the groin, just let me know, okay? Push up for me. And nice shot. One more time. And relax me, Traci. Alright. And typically after this, again, we want this to be nice and easy coming over. Her hips coming off the table here and the SI joint stretching. And then we bring this back, trying to stretch out her hip joint here. Now typically with Traci, she's going to have a little discomfort when we bring this knee down to stretch a hip joint. Any pain at all, Traci? Just a catch?
Mild, tiny.
Tiny bit? Okay, all right, bring this all the way down. Push up in right there, Traci. And relax me. Good. One more time. And relax me, Traci. Good. So again, this is the figure four position here that we want everybody to have. You know, could that really help to stretch out the hip joint itself and to protect the hip joint for people. So you can do the same thing to both sides. Push up in right there, Traci. And relax me. Good. One more time right there, Traci. And relax me. Good. We're going to bring this all the way up. And we're going to do the same thing to your right hip here. Right? Let me know, Traci, anything in the groin? Yeah, and this one, she usually doesn't have any much pull or grabbing in the groin here. Go ahead and push up for me. So this hip is usually better for you, right?
Yeah.
Again, push up for me. Yep, so it hits her more in the QL and the SI joints for me. Good. Resist again for me right there, Traci. Nice job. One more time. And relax me, Traci. Good. Alright. I'm going to lock this knee for me. And we're bring this all the way down. Keep your shoulders back for me and stretch your QL for you a little more. Good. Push up for me, Traci. Nice job. One more time. And relax me, Traci. Nice job. Alright, next thing we're going to have her do is we're going to have her go on the right side for me, Traci. We're actually going to adjust the left SI joint for you. Alright, let's have you keep your bottom leg straight. Bend your top one here. Good. I'm going to have this on. Roll this underneath you. I want to roll you forward just a teeny bit here. Right, stay right there for me. Go ahead and take a deep breath from me right there, Traci. And breathe out for me. Good. Nice and easy. Lock shoulders for me. Good. Stay right there for me. Nice job. Alright, let's have you go face down for me, Traci. Alright, we'll check The leg length out. Pretty even, Traci, not bad. Right side might be just a teeny bit short. Alright. I will bring this all the way down for you. Traci has pretty good curvature in her low back. She has pretty good kyphosis up here, not really rounded much at all. Again, we're looking for any discrepancy in the upper thoracics. A lot of people get rounded up here, but her posture is pretty good. We have a couple movements up here, a couple segments up through here, right around the T8 right here, that we would adjust for Traci right there. Go ahead and take a deep breath from right there. And breathe out from Traci, relax shoulders from all right there. Good. Keep going, Traci. And breathe out from me, relax your shoulders from Good job. And again, it's your T3. And breathe out from me, all right there, relax shoulders. Good. And again, right there, Traci. And breathe out from me, all right there. Good. Alright, now we're going to put some pressure. We're going to do some active release or trigger point right around the rhomboids. Usually this can be pretty painful for some patients. Is that sore at all, Traci? It's tolerable? She's screaming down there.
It's a good pain.
It's a good hurt, alright? Hurt right there. Good. Nice job. And typically, again, we're going to release the rhomboids area, the lower trapezius muscle. And I am putting a lot of pressure on her, so it might not it might not look like it, but we do put a lot of pressure right in these parascapular muscles of the back here. Good. Keep going. And nice job, Traci. Alright, let me see the arm. I'm going to bring this up. Again, I always double check by making sure that the shoulders and arm go all the way back to get a good stretch in the pec muscles. Again, that also tells us this is leveling off nicely. Let me have you bring the right arm up. Bring all the way through. Nice job, Traci. Now again, a lot of people who have tight pec muscles, they're also going to have weak upper back muscles. Hence, they're going to have that roundedness in the upper back too. So we call that kyphosis, or in the olden days, they call it dowager's hump. In the more upper region, and then in the middle region here, they call that Gibbs formation or hunchback in men. In the modern term now, we just call that kyphosis, or hyperkyphosis is with the roundedness that is increased. All right, one last one right there, Traci. Take another deep breath in for me, and breathe out for me, like shoulders for me. Good job. So as you can see here, again, that's probably her worst spot is right through here, right, Traci?
Yeah.
So again, this is really good curvature in your low back, but she's the most rounded right through here. And that can also affect people with doing some extension exercises as we work on them. So, all right, Traci, go ahead and get up for me. So how does it feel?
Good.
It didn't hurt you too much, right?
Not at all. A little
Okay,
bit.
a little bit. All right. So,
yeah, really good.
good. All right. Any question about anything at all?
No. Not
Okay.
at
All right.
Actually, yes. Should I heat or ice after?
Typically, after we work on people, if you get sore,
Yeah.
you can put some ice in it.
Okay.
But typically, if you don't get sore, you can't keep the heat on it at night. It helps to loosen up some of the muscles.
Okay.
So, yeah, which is gonna help you a lot more. So,
Okay.
but thanks, Traci, for joining us.
Welcome.
Again, she's a great Pilates instructor. So, any hints or any tips that you can give up about being or the people that want to get into, Pilates?
Yeah, absolutely. I think there's a huge discrepancy or misconception about what Pilates is, that it's all stretching. And it's a lot of strengthening as well. It's all tension-based with springs and focusing on the little tiny ligaments and tendons that hold the muscles in the body together. So it's just great for everyday activity. And I've got all the equipment. I've got a full studio next door. So.
And the resistance is actually really important, just like you're saying, it's not just the mobility end of it. The resistance makes a huge difference on patients who are older.
Yeah, and it depends on what we're doing and what range of motion we're looking for. I can add or take away the resistance. And it teaches people stability with mobility, which to me is one of the most important things. Yeah.
So basically, like when you are lessening up the tension, you can work on people that have a lot of issues with arthritis, a lot of people that have a lot of pain, because a lot of people that are in pain, it's hard for them to go in the gym and do a lot of weight-bearing exercises, with weights.
And a lot of this too is all a lot of lying down stuff. So it's taken off the joints, it's taken off the knees, the hips, and the shoulders. And it's actually, we were just speaking about this. If I take away spring for you, you have to do more work because you have to support yourself.
Oh, I
so
see.
if I add more spring, yeah, it's a lot different than people would say adding weight to the gym.
Okay.
Some of the exercises, if I take away, it actually changes that up for them.
So the more springs basically gives them more support.
Right, exactly. So when I take away the springs, and you're now having to support yourself and move, you know, the equipment, the apparatus kind of moves in certain directions that you don't have to move it on your own.
That's awesome.
Yeah,
Right. See,
yeah.
I learn something new every day. So, but all right, guys. So definitely, thanks for checking in, and thanks Traci for helping us out.
Absolutely. Thank you very much.
All right.